Video we will Hello friends, in this video we will discuss CMS 2020 paper 2. We have already covered paper 1 in the previous videos, so this paper 2 will also be covered in 2 to 3 parts. So let's start with the first question. Indication of fasciotomy in the compartment syndrome include all except. So for the indication of fasciotomy are palpable distal pulses as not an indication of the fasciotomy, because fasciotomy is done when the pulses are not palpable. So palpable pulses is not a indication. And compartment syndrome, compartment pressure greater than 30 is indication. Pain on the passive movement is also an indication, and distal sensory disturbance is also a indication. So here the answer will be D. Which of the following statement is not correct regarding the necrotizing soft tissue infection? So here it is talked about necrotizing fasciitis. So which is not correct? So let's start with the first option. Crepitus, skin blistering and focal skin gangrene are typical presenting feature. This is true statement. Treatment consisting of wide local excision and appropriate antibiotic. This is also a true statement. Tissue biopsy is required for culture and diagnosis. This is also a true statement. They are the monomicrobial in nature. No, this is not a true statement. This is a false statement, because we know in the necrotizing fasciitis the infection is polymicrobial. So answer here will be B. Which type of surgery is laparoscopic cholecystectomy classified as? So if we talk about the clean surgeries are hernia, mastectomy, etc. In clean contaminated, laparoscopic cholecystectomy, hysterectomy, tubectomy, laryngectomy, all these will be included. So answer here will be clean contaminated, because it is they were asking about the laparoscopic cholecystectomy. If we talk about the dirty, then perforation of the bowel will be included in this. A 22-year female has presented with the history of malaise, cough, alternating constipation and diarrhea, and with the intermittent abdominal pain for the last 6 months. She also complains of the abdominal distension for last 2 days. On examination, her abdomen has a doughy feeling along with the ill-defined mass over the right lower quadrant. So here the history is given for the 6 months, and cough is also present and abdominal distension is present. So these all are the feature of the ileocecal tuberculosis, because ileocecal tuberculosis generally involve the terminal ileum. So there will be the ill-defined mass in the right lower quadrant, and also it has the chronic presentation. So 6 months presentation is given. So answer here will be ileocecal tuberculosis. Consider the following statement regarding the needle stick injuries. Injured part should be washed in the running water. This is true statement. All needle stick injuries should be reported. This is also true, because we do not know the patient's condition or the patient diseases which the patient has. So we have to report all the needle stick injuries. Hepatitis or HIV testing should be done after the needle stick injury. This is also true. Dominant index finger is commonest site for the needle stick injury. This is not true, because generally non-dominant index finger is injured during the needle stick injury. So here the answer will be 1, 3 and 4 sorry. So option C is correct. Consider the following regarding the claudication. It is a marker of silent coronary artery disease. This is a true statement. Structured exercise program leads to improvement in the symptom. This is also true. Diabetes mellitus increase the risk and the severity. This is also true. Beta blocker may exacerbate the claudication. This is also true, because they will lead to the vasoconstriction. So here the answer will be 1, 2, 3, 4. All the options are correct. Answer will be D. A 50-year-old lady underwent uneventful bariatric surgery for morbid obesity. On the third post-operative day, she develops breathlessness and pulmonary embolism is suspected. The next investigation to confirm the diagnosis is So for pulmonary embolism, we know that the screening test is the D-dimer, and investigation of choice is CT pulmonary angiography. So here we will do CT pulmonary angiography because pulmonary embolism is suspected, and in this modified Wells score is considered. If the modified Wells score is less than 4, then we will do the screening with D-dimer, and if the Wells score is greater than 4, then we will directly do the CT pulmonary angiography. So here answer will be C. Medical management of thyrotoxicosis. Thyrotoxic crisis include all the following except. So we have to give IV fluid, this is true. IV propranolol is also given for symptomatic relief. IV hydrocortisone is also given, but IV antibiotics do not have any role in the thyrotoxic crisis. So here the answer will be IV antibiotic. Patient operated for the parotid gland tumor develops symptoms of sweating and erythema, which is flushing over the region of the surgical excision while eating. So they are talking about mainly the Fresh syndrome. In this, the mixing of the sympathetic and the parasympathetic fibers occur, and generally auriculotemporal nerve is damaged in the case of the Fresh syndrome. So answer here will be D. First line hormonal therapy for postmenopausal women and with metastatic carcinoma breast is. So when they are talking about the postmenopausal women, then we will prefer anastrozole, not tamoxifen. So here answer will be anastrozole. So if they are talking about the premenopausal, then we can give the tamoxifen. But if they are progesterone and the estrogen can be given. But they are talking about the menopause. After the menopause, then anastrozole is considered, not tamoxifen, because tamoxifen is the SERM and it may lead to the increased risk of the endometrial carcinoma. So here answer will be anastrozole. All the following are the major subtypes of the breast cancer based on gene array analysis except. So we know that luminal A and B are present, are the major subtype. Triple negative also a major subtype, and HER2 new positive is also a major subtype. But estrogen receptor positivity is not a single major subtype. It can be considered, but it is not a major subtype. So answer here will be estrogen receptor positive. And for HER2 new positive, the treatment is trastuzumab. All the following are sequel of the peptic ulcer surgery except. So after the peptic ulcer surgery, following complication can be there, such as the bilious vomiting, this is true. Dumping syndrome can be there, and diarrhea may occur. But increased appetite is generally not seen, because generally after any surgery, or specifically if we are talking about the peptic ulcer surgery, then appetite generally decrease. So here answer will be increased appetite is not seen in the peptic ulcer surgery complications. Child Turcot Pugh score for quantifying the severity of chronic liver disease includes all the following except. So for the child Pugh score, we know that the trick is BAAPE, which include the bilirubin, albumin, ascites, PTINR and encephalopathy. So bilirubin is included, albumin is included, and INR is included, but serum creatinine is not included in the child Pugh score. So here answer will be C. Chain of lax appearance due to circulation with intervening short strictures of pancreatic duct is seen in. So chain of leg appearance is seen on the ERCP, and it is seen in the case of the chronic pancreatitis. So answer here will be ERCP. Which of the following is not correct regarding the pyogenic liver abscess? Anorexia, fever, malaise, and right upper quadrant abdominal discomfort are the most common presenting feature. This is true. It is more common in elderly, diabetic, and immunocompromised. This is also true. Treatment is with the oral antibiotic alone. not alone. We give the oral antibiotic, but we have to also do the USG guided aspiration. So answer here is C. We cannot treat the pyogenic liver abscess with oral antibiotic alone. We have to also do the USG guided aspiration in some cases. Streptococcus and E. coli are the most common causative organism. This is also true. So answer here will be C. Swiss cheese defect are seen during the laparoscopic repair of the. So Swiss cheese defect is seen in the case of the ventral hernia. This is a direct question. Which of the following are correct regarding the splenic artery aneurysm? So splenic artery aneurysm, main arterial trunk is the common site. This is true. Palpable thrill can be felt. This is also true. It is a symptomless unless it rupture. This is also true. Generally, which of the following is true? Palpable thrill can be felt. No, this is not true. This option is not true. Palpable thrill is not felt. Instead, the bruise will be felt. So here option 1 and 3 are correct and 2 is wrong. So answer here will be option C, which is 1 and 3 only. Valentino syndrome, it is a direct question. We have to remember that it is a pain in the right iliac fossa in the perforated peptic ulcer. So whenever there is a perforation of the peptic ulcer, if there is a pain in the right iliac fossa, then it is known as the Valentino syndrome. Spontaneous bacterial peritonitis occurs due to. So spontaneous bacterial peritonitis generally occur due to the acute bacterial infection after the ascites. So answer here will be acute bacterial infection. Acute bacterial infection. Option C is correct. Structures not forming the boundary of triangle of doom are. So we know that this is the triangle of doom and this is triangle of pain, and this hole is known as the trapezium of disaster. So in the triangle of doom, in the medial side, the boundary is formed by the vas deferens. So option A is correct. Then the lateral boundary is formed by the gonadal vessels. So spermatic cord vessel, this is also correct. And the lower part is formed by the peritoneum. So option D is also correct, but option B is not correct. The inferior epigastric artery generally forms the boundary of the Hasselbalch triangles, not triangle of doom. So answer here will be B. The term midline shift is associated with. So midline shift is generally associated with the head injury, and tracheal shift is associated with the chest injury in which the trachea shift to the opposite side. But the midline shift is generally associated with the increase in the ICP in the head injury. Which of the following cranial nerves does not supply the external ear? So cranial nerve fifth supply. We know that cranial nerve 5th, 7, 9 and 10 supply. So 5, 7 and 9 supply, but not cranial nerve 6. So cranial nerve 6 do not supply the external ear. Left internal mammary artery has been a conduit of choice for the left anterior descending artery during coronary artery bypass grafting because it has a long-term patency rate of more than 98%. So nowadays the lima is more commonly used and it is the best conduit for the LAD artery bypass grafting. So answer here will be A. A 50-year-old male with significant smoking history presented in the surgical emergency with the sudden onset breathlessness. Chest X-ray show right-sided pneumothorax. The appropriate management will be. So here we have to put as it is a case of the right-sided pneumothorax, but it is not a tension pneumothorax. sudden severe breathlessness is there, and smoking history is present. So it is most probably occurred due to the rupture of the bulla of the emphysema. So here this is the secondary pneumothorax, and in secondary pneumothorax we do not put directly the wide bore needle. Instead we will put the drain. So here the right chest drain will be put, and size should be 8 to 14 French. Which of the following regarding the phelon is not correct? There is an infection in the fingertip, specialized fibrous septa. This is true. Incision and drainage is the treatment of choice. This is also true. It is common in diabetic. This is also true. And it is a painless condition. This is not true. Phelon is a painful condition, and the treatment is done with the antibiotics and incision and drainage. Most common site for the osteosarcoma is, so this is a direct question. The most common site for the osteosarcoma is either the distal femur or the proximal tibia. Rapid sequence induction is indicated in. So rapid sequence induction is generally indicated in the case of the emergency, when we have to quickly give the general anesthesia, and generally the succinyl choline is used for this. So rapid sequence induction is indicated in emergency surgery for intestinal obstruction. This statement is true. Which of the following statement about compartment syndrome is not correct? It is the commonest in closed fracture. This is true. Pain is on active movement but not on the passive movement. This is false. Pain generally occur on the passive movement, not on active movement. Fasciotomy is the treatment of choice. This is true. Waxman ischemia contracture is a late complication. This is also true. Which of the following is not the strength of ultrasound as a diagnostic modality? So no radiation. This is the advantage of ultrasound. It is inexpensive. This is also an advantage. Allows dynamic studies to be done. This is also advantage. But short learning curve is not an advantage. Instead, ultrasound is very difficult to interpret it. So it has a long learning curve, or difficult. It is very difficult to learn about the ultrasound. So this is not the advantage or strength of the ultrasound. Which of the following regarding the lymphedema following the breast cancer treatment are correct? Incidence has decreased due to rarely combined therapy of axillary lymph node dissection and radiotherapy. This is true, because incidence nowadays has decreased for the lymphedema due to the newer therapies. Precipitating cause like lymph node metastasis is a major determinant. No, this is not true. It is not a major determinant. It can be the reason, but it is not a major determinant. The condition is often painful. Yes, this is true. Edematous limb is susceptible to bacterial infection. This is also true. So here option 1, 3 and 4 are true. So option C will be the correct answer.